Hi, I'm Dr. Raajam Murali, Senior Consultant of Infertility at GarbhaGudi IVF Center, Hanumanthanagar, Bangalore. Today we are going to discuss about the latest technologies in infertility treatment. The first one is pre-implantation genetic screening or diagnosis. Pre-implantation genetic screening is a test done after IVF treatment on the embryos to detect if there is any chromosomal abnormality in the number or structure of the embryo. So in a regular IVF, after the embryos are made, few cells of the embryos are biopsied and sent for testing whether they are chromosomally normal. And the chromosomally normal embryos are called euploid embryos, and the chromosomally abnormal embryos are called aneuploid embryos. Aneuploid embryos, they do not implant, and they are the reason for implantation failures. So when you transfer an euploid embryo, the success rate of an IVF increases by 10 to 15%. And also by transferring an euploid embryo, the time to pregnancy also becomes lesser. So pre-implantation genetic testing is not for everyone. It is for couples whose age is more than 38 years of age, or who have repeated IVF failures, or who have repeated pregnancy loss. The second advancement in infertility treatment we are going to see is PRP, which is platelet-rich plasma. Platelet-rich plasma is made by taking 20 ml of the patient's blood and then centrifuging it and separating the platelet-rich growth factors from it. These platelet-rich growth factors can be injected into the ovaries of women with low ovarian reserve, so that 6 or 8 weeks later, the ovarian reserve increases, their egg number increases. So by injecting this platelet-rich plasma into the ovaries transvaginally by an ultrasound guided technique, the antral follicular count can be increased in a woman with low ovarian reserve. And this platelet-rich plasma also can be used to grow the endometrium. In women with thin endometrium, the same platelet-rich plasma can be put inside the uterus to grow the women's endometrium also. So platelet-rich plasma has two uses: one in women with poor ovarian reserve who has less egg numbers, to increase the egg numbers, and also in women with thin endometrium to grow their endometrial lining. Third advanced treatment we are going to see is in vitro maturation. In vitro maturation is another form of IVF in which immature eggs are retrieved and then they are grown in the lab to mature eggs, and then from those mature eggs, embryos are made to be transferred into a woman's uterus to help her get pregnant. So in vitro maturation is also not for everybody. It is most commonly used in polycystic ovarian syndrome patients, where the egg reserve or their number or their AMH is very high. In such patients, when they do a regular IVF, if the quality of embryos, if the quality of eggs are not very good, an IVM is an alternative for them. In IVM, immature eggs are retrieved after giving very few injections, and these immature eggs are matured in the lab. Only 50% of the eggs mature. When they mature, they are injected with the husband's sperms to make embryos and then transferred into the women's uterus to get pregnant. In the case of IVM, the success rates are equal to an IVF, and the risks of OHSs are completely nil, and the cost of the medications are also very less when IVM is offered to a patient. The fourth advanced treatment we are going to see is time-lapse imaging or embryoscope. In an IVF lab, when we do IVF, the embryos are cultured inside incubators in a proper culture conditions with proper temperature, pH, osmolarity and all. This time-lapse imaging or embryoscope is a special type of incubator which monitors the embryo 24 hours and gives us the input through a computer about the growth of embryos. By knowing the complete growth of embryos, we can select the embryo which has got greatest implantation potential, or which is the embryo which is going to attach to the uterus to give a pregnancy. So it increases the success rates of an IVF by 10%. And when we use embryoscope, if a normal incubator is like a photo imaging, embryoscope is like video imaging. It gives the complete growth of the embryos for those 5 days when it is cultured, and by giving the complete picture of the embryo growth, we'll be able to select the best embryos for transfer. Fifth advanced treatment in IVF we are going to see is sperm selection technique using microfluidics in men with low count or low motility or low normal forms, or in men with very high DNA fragmentation index. Microfluidics can be used to select the best sperm for ICSI. So in a sperm count, you will have millions of sperms. In that sperm, which sperm will give a very good quality embryos, you can select through this technique of microfluidics. By using microfluidics, we can select the best sperm for ICSI, and thereby the embryo quality will be good. Thank you.